A battle with cancer, how a tiny spot on your body could lead to a deadly diagnosis. One of our own here at San Diego 6 shares her story of surviving with melanoma.
Well, the sun shines here in San Diego about 260 days a year. No doubt we live in paradise, but the number of nice sunny days only increases our likelihood of developing skin cancer.
And in the effort to raise awareness, today is known as Melanoma Monday. It is the deadliest form of skin cancer, and it actually touched one of our own. San Diego 6's Jenny Day joins us live. And Jenny, you have been very candid in talking about your experience.
That's right, Jim. Cancer strikes far too often. Way too many of us have a story, including myself. I've lost both my parents to cancer and have had melanoma twice. That's why I want to do everything I can to educate people on the importance of early detection and ultimately save some lives. So whether you're black, brown, or as fair as I am, cancer knows no boundaries, so we all have to protect our skin.
The statistics are startling.
1 person an hour passes away.
There are 135,000 new cases of melanoma every year. 1 in 5 of us will develop some form of skin cancer. The most common cause, UV exposure, either from the sun or tanning beds.
It really strikes people in the prime of their life. So, for example, in younger adults, aged 25 to 35, it's actually the #1 cause of cancer death.
That was the case for me. In 2013, my world shattered when I received the diagnosis. Me, melanoma at 26. Growing up in San Diego, the sun frequently shined on my skin, but also genetics. I have a family history. My mom was a fair-skinned redhead like me who died from melanoma at 55. If caught early, though, it's almost always curable. I had surgery on camera to help raise awareness, and now I get checked every 3 months. The average person should be screened annually for the A, B, C, D, and E's.
A is for asymmetry, so one half doesn't look like the other. B is for border. You know, the border is a little bit irregular. C, if there's 2 or more colors or strange colors, blue, white, black, pink. Those are things we don't like. D, diameter greater than 6 millimeters, which is about a pencil eraser head. And then E is the most important, evolving. So if something's new or changing, you really want to get that checked out.
Be familiar with your skin and check yourself once a month.
Head to toe, in your scalp, in your mouth. Have people look at your back, backs of your legs.
If something looks funny, you'll have a biopsy done. If it happens to be something serious, a follow-up surgery is done to be sure they got it all. Again, if caught early, highly treatable and curable. If not, it can spread.
Once it actually starts diving, it's just an aggressive cell type, so it easily gets into the blood vessels and then to lymph nodes.
So we don't want to fear our San Diego sun, just protect ourselves from it, because prevention is a lot easier than intervention.
Jenny, very brave of you to do that surgery on camera, and this warning that you have for people, it's a personal account of what you experienced, so we appreciate that.
My pleasure, truly. I hope it helps in some way. Just go and get screened. It's way easier than going through chemo or radiation, some of these other things. And again, sunscreen, you know, it's so easy. I know it can be a hassle, but sunscreen, protective clothing, all these things make a huge difference. Prevents wrinkles as well, so a lot of good benefits to it.
And for you in that video, the surgery was on your leg. Was there, how did you even notice that that was there?
You know, it was such a tiny dot. Mine really didn't look like a classic melanoma, but it was very small, but jet black. And anything on my skin, that's so obvious that's not normal. So
Right. Very fair-skinned.
Right.
Yeah. I had a similar experience, same on my wrist. It was like a scab. The doctor at first said it's nothing. A year later, it was still there. Let's check it out. Surgically removed, and it was precancerous, but man, very common.
Yeah, it really is. So, and we're lucky to live here with all our sunshine, but it does make us more
aware.
I've seen you lather up. You do it very well.
I do.
She definitely does. It's very protective.
Jenny, thank you.
You bet.